Okay, this video is to help you understand what can go wrong with B12 in the body. So I have a diagram here. This is the stomach, this is the bloodstream, and this is the tissues. Now with B12 there are two main transporters. There are others, but these are the two important ones I'm going to talk about today. So in this person with normal B12 function, the food comes down into the stomach. The B12 is extracted. I'll just write that in. And what happens is intrinsic factor in the lining of the stomach here, I will draw that on as IF, picks up the B12 and transports it over into the bloodstream. Now, once the B12 is in the bloodstream, there's another transporter called transcobalamin, or TCN2, and that takes it across here into the tissues. So this patient here has normal intrinsic factor, normal transcobalamin, and the B12 has passed across into the blood and then into the tissues. So this patient will have no symptoms. Okay, next we have this patient has problems with their intrinsic factor. Now this is the mechanism that doctors most recognise. So the food comes down into the stomach. The intrinsic factor here doesn't work properly, so that the B12 cannot get across into the bloodstream. Now what happens when the doctor or the nurse takes a blood sample? You can see there's not going to be any B12 in the blood, so the level will be low, and they can then see that the patient has a problem with B12. They can also do an intrinsic factor test, which will also show that the patient has a problem. So this is quite obvious to the clinician what the issue is. Now then, this patient here has problems due to transcobalamin. Let's go through it again. The food comes down into the stomach. The intrinsic factor works perfectly fine. So the B12 passes across into the blood. Here we are, B12 in the blood. Passes across no problem. Now then, the transcobalamin doesn't work properly. So the B12 sits and it pools in the blood. So when the doctor or the nurse takes the blood sample, you can see what happens is they detect plenty of B12. What they will tell you is that you have a normal B12 level. Also, when they check your intrinsic factor, because that's working, they will also tell you your intrinsic factor is fine. Now then, this can be misleading. You can see that your B12 level will be normal, your intrinsic factor will be normal. What they can say to you then is you don't have a B12 problem, but remember, 25% of patients with B12 issues have no anemia. You do not need to have large red cells. Your B12 level will be normal and your IF intrinsic factor test will be normal. So serologically all of your tests are normal, but you can see B12 is not getting into your tissues and you will have symptoms. Okay, this chart here is from the BCSH, British Committee for Standards in Haematology. So haematology consultants should be using this table to help them with diagnosing. We'll start at the top here. Strong suspicion of deficiency. Your symptoms are going to be numbness, tingling, weakness, gait issues, swallowing problems, hearing disturbances, visual disturbances, bowel and bladder problems, brain fog, and the biggest one is fatigue. So if we start here, strongly symptomatic. If your level is less than 200, if you have the usual intrinsic factor problems, they will recognise that and they'll treat you. This is the pathway they'll take. But here, the BCSH recognises functional deficiency, which is the transcobalamin problem. And they say here the level can be over 200. And this is what they recommend to do. Check intrinsic factor, which will be normal, but also to check MMA and active B12 and homocysteine. These are tests that all show that your tissues are deficient. So those are the tests you need. It also says here, this is very important, start empirical treatment. So even if you have a B12 level above 200, because you may have a functional deficiency, you should always have a trial of injections. And then down here, what to do. If your further tests are positive, continue with treatment, but also if you have a good response to the injections, you should also continue with treatment. Now then, what is the treatment for patients with neurological symptoms? The BNF states very clearly, here we are, alternate day injections until no further improvement. So there we have it, B12 problems due to transcobalamin. Your serological tests may all be normal, but your tissues will be deficient. So do please push for frequent B12 injections. Thank you.